Kia ora koutou, ko Jackie Lundy-Johnston, Executive Director of Allied Health Scientific and Technical and Executive Lead for Disability within Canterbury and West Coast DHBs. No mai haere mai, we're delighted to have you all here. This session is being recorded so that it can be available for anyone who hasn't been able to join us live today. We're hoping that we might be able to have a sign language interpreter, and unfortunately we're unable to secure anybody today because they are in high demand. But as we've said, we will hopefully be able to share this with everybody and do what we can to get that captioned. We are having a group of people, some of our subject matter experts that we will step through, and you'll see the running order there on the sheet. I am Scottish, for those who are questioning. It's not a Kiwi accent, obviously. And we will have questions during the session. So we would ask that if you're able to type your questions in the chat session, and if you're not able to do so, that you would be able to raise a hand to ask a question, and we'll keep the questions to the end, but feel free to type your questions as we go along, and our moderator will help us in sifting through those so that we can try and get as many answered as possible. We will finish sharp at 1 p.m. because many of our participants as well as experts on the call will have other meetings that they need to go to. And if we don't get through all the questions, we will be putting together some Q&A, some FAQs after the session, which we can circulate to all of our participants. So we're really delighted to be having this session today specifically for our disabled community. And we have a fabulous panel who will do their best to share some great information with you and answer your questions as we go. So we will be finishing at 1 p.m, Simon, just to clarify. Yep, and we will be sticking to that time because of everybody's other commitments. So without further ado, I'm going to hand over now to my wonderful colleague, Allison Nichols Dunsmuir, who's been a key part of our disability response within the vaccination service. Over to you, Allison. You're still on mute, Allison, sorry.
It's better. Kia ora, everyone. I have been involved for a while, and I'm going to talk today from somewhat of a personal perspective, and I'm going to start with show and tell, which I seem to be doing when I do webinars. There is a lot of information that I have been collecting. This is my getting ready plan for myself and my husband. And when I sat down to do that, there were a number of things that came to mind. So I started talking to people in the community around the things that they had on their mind and how we might just raise that and get some greater awareness. I am directing this to people who have a disabled person or someone with a long-term condition that has disability implications in their household. Okay, so because once someone is positive for COVID-19, we start to look at things from a household perspective because it's households that have to isolate. So, and we're all, of course, doing whatever we can to reduce our risks of becoming infected. We're all fully vaccinated, have gotten or are just ready to get our boosters. And we're carrying on with all the public health measures that we all know well, masking and washing our hands. And despite all that, some of us will become cases or close contacts, and we will have to think about how that's going to affect our lives. Now, another show and tell, the Ministry of Health has done something called a Getting Ready checklist. And so we started with that. And we went through, it's a generic document. It doesn't purport to address disability related issues and households and how things are organized for people. So went round, asked people, and we've just released yesterday something that we're calling a Getting Ready Checklist Disability Supplement. So it means starting with the general information from the Ministry of Health, but this information is quite specific of things that people might want to think about. And so I'll take some time to go through that a bit. All right, so what we're encouraging is people to record relevant information all in one place. It's better to have it pulled together before this is real for people. Because once a word comes through that you have been, someone has tested positive, there are a whole lot of things that are going to happen. And so, boy, you having that a lot, as much as possible, pulled together ahead of time will be beneficial. Clearly, people need to stock up on necessary supplies. Every household needs to do that. But I'd encourage people to think about what's disability related, health related, that might be slightly different in your scenario. We want people to make connections, and both with your natural supports, friends, family, etc. And then also, really importantly, have an understanding of what will happen with your existing services that people receive. Everybody at home will need to stay home for the 10 days, whatever that is. You'll get really good instructions about exactly what it is that needs to happen. But that whole idea of not being able to go out as usual definitely presents some challenges. There are also limitations on who can come in, all right? So we'll talk about that. You'll get a package with supplies that will come from the hub, and it'll have information that people need. It will have a number for people to ring if they have questions. And so you'll sort of be in hand. There will be an umbrella around you at this stage. But before that, in order to make that process a bit easier, that's what we're recommending people do, is get this information and a plan in place. The system has to have quite a bit of information about the people who are positive and about the people in their household. So it seems silly, but it's not a bad thing to collect all of that sort of basic information about people. Everybody's name, birth date, NHI number. Everybody knows what an NHI number is. That's that unique identifier for the health system. And as things go, the NHI number is really important. You'll have known that when you were vaccinated. And it's linked to your passport, and all that. So let's just put that down somewhere where you could easily grab it. How to contact people is really important. So everybody in the household, if you have different email addresses, you write those down. I thought of one the other day, and I need to be careful how I say this, but it's turning out that a lot of information is now going to be driven by people's own entries into their My COVID passport. No, My COVID record. And so, that's something people might have done a few months ago. I got my record, I got my passport, and now I'm done with it. Well, now it's back. So you need to go back and dig out what was my password, how did we get all that, etc. We want people to have a good record of any medical conditions, any medical history. You know, I had a kidney dialysis or transplant this year. So sort of big things that happened in your history. Any disabilities. So thinking about what it is that are not straightforward for you to do. Okay, so you're saying, I walk with a mobility aid, or, you know, you're just being really clear that that is the scenario. Allergies, these are the things that are pretty typical medications that you take. And I'd encourage people to think about explaining your communication needs. Not everybody has fluid verbal communication. Anybody who is a sensory impairment, either blindness or deafness, those are really important you make that known really early on, because the system has to work with you to communicate in a way that is gonna be mutually agreeable. All right, now the second thing you need to think about gathering together is information on your usual care and support arrangements. And again, it's for every member of the household. So, you know, who is your GP? Who is your chemist? Where do you get any supplies that you need to receive? There are people who receive continence supplies. There are people who receive all sorts of things from certain suppliers, and you need to be clear where those come from, because someone might need to know that. You need to write down the details of any care and support agencies and services that are involved in your household. And what exactly are the services? You'll be aware that there is a strong intention that people's existing services will continue through the pandemic and through people being positive and having to isolate. That is the goal. And the idea is that it will prioritize the most high needs, and it will prioritize essential services. All right, so you might receive a range of things that we certainly do in our household. Some we could put on hold for a while, or maybe reduce a little bit, but there are other things that have to carry on. And a lot of the big issues are around services that are delivered in people's homes, the stress on the home-based support services sector, and making sure that people are not going to fall through the cracks. So all I'm talking about now is let's gather all together the background information. It's good for people you might get asked who funds these services, because there are different ways of addressing services that are funded by ACC, services that are funded by the DHB, or by the Ministry of Health or Ministry of Social Development. Okay. Things like, do you have upcoming medical appointments or other appointments and need to do some planning around how those would happen if you had to go into isolation? All right. And I would suggest that people do look at the list and have a good sit down with that and pull together information. Okay, so that's the first big bit of making a plan. The other part is, and I don't want to frighten people, but give some thought to a plan of what would happen if someone had to go into hospital. Somebody in your household had to go into hospital. And there's a little section in the document on that just asks people to think about any previous experience around hospitalization and what kind of things are good to plan for, what questions are good to have, And one of the questions that I'm quite interested in is, when you go to hospital, will the clinicians that usually work with you or your family member be involved? So ask that question. So let me just, I had a question saying, where is this information? And I will clarify that. Let me just see, I'll wind up shortly. There are questions around PPE that are very relevant for disabled people, and that is generally addressed through some changing arrangements. They are, for the most part, by way of people employed to look after people. They have to, their employers would supply them with PPE, but it wouldn't be a bad thing to have a supply of your own. The other things are pulse oximeters to measure your oxygen rates, and rat testing. So there's bits and pieces that are involved in this scenario, and you do need to find out more about those as you can. All right, do take the initiative, ask questions. Your GPs will be a key part of this, and so often the first port of call, but the hub is also an important source of information and support, and we will be increasing the ability to respond to individuals. All right, we are the information about the disability supplement to get ready is sitting on the Canterbury District Health Board's website, so the main public site, and you go, there's a band on the top, and it's the COVID-19 band, and it says care in the community. I think it's also now down lower, but it will be pretty straightforward. If you are looking for care in the community, then the disability supplement will be in there with some other really good resources. So I'll finish there. Thanks.
Thank you. And we will share the link to that part of for the website with our Q&A, so that people can have that as a reference point. Thank you so much. I'm going to pass on to Kathy O'Neill now. Over to you, Kathy.
Kia ora koutou. My name's Kathy O'Neill. I work in the Canterbury District Health Board in a place called Planning and Funding, and my role is to provide resources and support to places like general practice, making sure that tests are available, supporting and resourcing the hub so that all of our wonderful clinicians can do what they need to support you. So I just want to talk about, it says a positive test is the topic that I'm taking. A positive test occurs, but I want to go back a step and think about, maybe you wake up early in the morning, you've got a cold-like feeling, you've got, you might feel a bit hot and sweaty, a headache, and you notice that your smell and taste isn't the same. What happens there? Well, you need to do the usual things that you do when you're unwell. Look after yourself, drink water, take Panadol or what you usually take if you've got a temperature. And we have been recommending that people get a test. When you have those respiratory symptoms, you get a test. Now, testing is available at testing sites across the city. There are 3 testing sites in Christchurch, also testing site in Ashburton, and we are opening up in Rangiora and Wollaston. And also your general practice can provide a test. Anything you go to your GP for in terms related with COVID is free. So don't worry about the cost of contacting your GP. So those tests at the moment have been one that is a swab that's taken from inside your nose, and that is administered by a health professional. a GP or someone at those testing sites like a nurse. That is going to shift. We're shifting to, Allison mentioned something called RATS. RATS means rapid antigen testing, and it's a test that you are given a kit to test yourself. So please follow the news over the next few days, because we are moving from that nasal supervised test to RATS. So you find out that your test is positive, and what happens next? Well, like I say, you need to take care of yourself. You need to isolate at home if you've had a positive test for 10 days. If you are a household contact, then it's 7 days. So all of that information can be readily available on the ministry websites. Within a short period of time, if you're enrolled with a general practice, your general practice will be in touch with you. They will know you. They will want to talk about your risks and think about that, and what other circumstances happen in your household. They'll develop a plan with you, and it might be that plan is actually relatively straightforward, that you've got some mild symptoms, you're not feeling that unwell, and they advise you to what you would need to do if things started to change. Or the GP or may decide that they're going to ask your carer or one of your providers, if you have someone coming regularly into your house, about that they will monitor and get in touch with the GP if there's any concerns. So we do want to use your natural supports as much as possible. Thirdly, your GP might be concerned that you are at risk of becoming more unwell, and they want to keep a closer eye upon you, and you arrange a plan about how frequently the general practice, it might not be the doctor themselves, but maybe a nurse, gives you a call to find out how you're doing, and does that every day for an agreed period of time. Allison also talked about something called a pulse oximeter and thermometer, so taking temperature, checking your oxygen levels, with a pulse oximeter. That would be something as well that your GP will assess. If you need that, they will arrange for a kit to be sent to your home. And I think Lucinda will talk more about that in relation to the hub. So that's kind of the pattern of support that you'll get. I know a lot of you are concerned about if you have a positive test, or if your carer has a positive test or is exposed, has a close contact. I'm with Allison that you need to create a plan around that if that happens. And we are doing things to make sure that your carers, if they've been a close contact, can come back to work safely by giving them a RATS kit so that they can test themselves and make sure that they're not positive when they come into your home. So it's important that you know that you don't need to be concerned. People will be checking their status before they come into your home. The other question that gets asked is, what if I can't safely self-isolate in my home? And again, we can talk a bit more about that through the hub, because the Canterbury DHB, and soon it will be a place called MB, is ensuring that there is accommodation available that people can go to and safely isolate away from their home if they need to. That's usually something like a motel or somewhere, something similar. I'm going to stop there because that's quite a lot of information, and I think Lucinda, you'll build on that as well. Thank you.
Kia ora, Kathy. Thank you so much. Yep, and hopefully there's some nice linkages coming between all of our speakers. It sounds like we've got nice, almost like we planned it that way. I'll hand over to Lucinda now. Thank you, Lucinda.
Oh, kia ora koutou. It's a real pleasure to come and talk to you today. My name's Lucinda Whiteley. I'm a GP, a general practitioner, and I'm also working at the Canterbury Aora Coordination Hub, or the hub that Alison and Kathy have mentioned. I guess the first thing I just wanted to say, and really to just keep in your mind, that if you're vaccinated, then for most people now, COVID is going to be like a bad cold, a cold or a flu, you know, and for most of you, it's not going to be too dramatic, and it's just good to keep that in mind. I know when COVID first came and none of us were vaccinated, you know, that wasn't quite the case, but we've learned a lot in that time, and I would really encourage any of you that haven't got your vaccinations yet, or if any of you are due your boosters, I would really recommend you to get that, because that's going to stand you in really good stead. I wanted to tell you a little bit about the hub. The hub is really, each region has a hub. We have one in Canterbury, and really it's like a coordination center. So we're going to work in the background to make sure that we connect people up with the right care that they need, with the right clinical care, with the right care from doctors and nurses, with the right care for your welfare, to help if you need support like accommodation that Kathy mentioned, or MSD, financial support, or if you needed a social worker, or if you or your whānau or carers need advice. We may not have all the answers, but we can help to direct your questions and help you to find those answers. So we'll be learning alongside you when we're contacted. And really our job is to connect people up with what they need when we can. We're also going to be delivering those pulse oximeter gadgets that measure your oxygen level that Kathy mentioned. And I should say that most people with COVID are not going to need anything like that. They're going to just have it like a bad cold or a bad flu. But for the few people that do, then that's when your GP or the doctor or nurse that's caring for you would recommend that. And the hub can organize for that to be sent out to you and check that you know how to use it. We in the hub, we've got a team of people that we're all working together. We've got nurses, and we've got allied health social workers. We've got advisors and experts in all kinds of areas, including Allison, who spoke earlier. And we've also got Mana Whenua and Maori and Pacifica advisors. And we're really just trying to learn from the expertise of people who know about these areas the best. And we're working with MSD, the Ministry for Social Development, as well, and they're helping us make sure we can get the right care and support for people when they need it. So when Kathy mentioned sort of what happens when there's a positive test, well, we can also see who has COVID in the hub, and we can make sure that people are connected up with, you know, I think your GP will be the best person for you to connect with. But if you didn't have a GP, or you know, we can help make sure that someone can look after you, and the hub might call you up to find out and check who you're under if it's not clear to our systems. Alison mentioned about writing down who's looking after you and who you're involved with. That's really helpful for us, because although it's actually not always super easy for us to work that out quickly. And so if you have a list of who your carers are and what agencies are involved with you, that's really helpful. And I would support that recommendation. That can help us to help you quickly if you need anything. And I think my main piece of advice would really be, do reach out. The health system's going to be busy, but actually we need to be using our time to care for people that need it the most. And some of you may be those people, and we want to make sure that we give you the help you need. So if you need something, and if you haven't been contacted by your doctor yet about a positive test, and if you're not well, Or if you have, but now something's changed and you've got worse or you don't have what you need, I would really recommend you to reach out to whoever can help you. And that could be your GP, it could be your whānau, it could be to your carer, it's whoever you trust, it could be to Healthline, but just tell someone what help you need and they can contact your GP or on your behalf or your carer and do something to help you. So people often worry they're going to be bothering us, but honestly, that's what we're all here to do. So just encourage you to do that. Okay, that's me, Jackie. Over to you.
Tēnā koe, Lucinda, that was great, thank you. And going to hand over now to Dr. Sarah Berger. Sarah, it's your gig. Thank you.
Thank you, everybody. Kia ora koutou. I'm Sarah Berger, the Nursing Director for the CDHB Infection Prevention and Control Service. I'm just going to touch on a few key technical points about infection prevention, which will include how COVID spreads and what we do about maintaining a hygienic environment. So what we definitely know now that we didn't 2 years ago is that a lot about transmission of COVID. And the easiest way to think of it is that COVID is spread through shared air. It is a tiny virus that's carried on our breath. And our breath has different sized particles, some tiny and some slightly larger. They're called aerosols and droplets. And the virus can stay in those particles that we breathe out. If you imagine breathing out on a frosty day with a nice big sigh, and imagine those moist particles that you see in front of you, that's basically what we're talking about. So if you wear a mask, if you can possibly tolerate that, but certainly if people around you are wearing masks, this is the main way that we can keep ourselves safe, aside from vaccination. And so it helps to understand that we don't need to worry as much about what's called contact transmission, the things we touch. So what we've noticed happening is that people hear, for example, about water testing for COVID. So they're worried that COVID might be in the water, or that touching things like, just daily objects that you might share, that COVID could be transmitted by that. So if COVID was found in the water, this is because it's been excreted, the dead virus. It's not alive and you can't catch it in the water. And anything that you might need to touch, as long as you're maintaining good hand hygiene with the use of sanitizer or soap and water. Now, for those of you, including I'm pretty sure Allison's husband, you might not be able to do your own hand hygiene, but certainly for those that are supporting you in your living situation, as long as there is hand sanitizer and the means to wash hands around readily for people, that's important. One thing that we really talk a lot about at the moment is that physical distancing doesn't equate with emotional disconnectedness. So we've been giving people lots of tips of how to keep safe and maintain appropriate physical distance, but stay connected. So there may be people that you enjoy catching up with and they don't want to put you at risk because you may be more vulnerable to illness. And so we're still theoretically, at least in summer, it's another cool and overcast day here in Christchurch, but there may be opportunities where you can have a visit that is in more of an outdoor setting, perhaps outside on a veranda or in an open doorway, just where there's a lot more fresh air and ventilation, or just the windows open and one of the house doors, so there's a nice cross draft. So the reason I'm talking about this is because what we know is that COVID is basically not transmitting outside unless you are crowded in a mosh pit at a music concert with a lot of people around you under the influence. But in normal circumstances outside, COVID can't really transmit, and this is because the entire atmosphere immediately dilutes any breath that we breathe out, and essentially just that infectious air is blown away by our gorgeous maritime sea breezes, and especially if you've got a mask on. So lots of fresh air and cross drafts and dilution through airing out the house is another really great tip. Just around laundry and waste. So if somebody perhaps has come to provide care for you, and there's any concern about how you manage laundry, the COVID virus is actually very easy to kill, because we've seen such devastating impacts of this virus overseas, and we see people walking around in TV images and media images with lots of PPE. So we'll have some sort of head cover, a protective eyewear or a face shield, a mask, gown, gloves, even shoe covers. I can explain that's because when you're in a situation where there is many cases, like in overcrowded and overwhelmed hospital systems, and as soon as you clean and decontaminate an environment, someone or multiple people cough and splutter and the environment's immediately contaminated again, particularly the air, then staff working in those environments have to put themselves in a little protective bubble of PPE. But in household settings or small group living situations, then even if someone is infected with COVID, because the virus itself can easily be killed with normal household cleaning products and just normal washing, and then through the dryer or out on the line. So if someone in your household or yourself were to have COVID, you can just do normal laundry. And it's the same with waste. What we do suggest is that before the waste is taken out by someone, that perhaps the plastic bag or bag it's contained in is tied closed. That just means if the bin blows over in a gusty wind, you haven't got all sorts of rubbish blowing down the road. But COVID can't really survive very long outside our own lungs and airway system. So I guess that my summary would be that while some of the other panelists have highlighted different resources available to support you, and that for most people, Omicron variant of COVID will be a mild illness. The other things just to remember about keeping yourself safe is just, where possible, if you can tolerate it, using a mask. If not, asking those people around you, family, friends, and those caring for you, to be diligent about their own mask use, and just know that plenty of fresh air coming through your living situation, and then normal laundry and waste management. Thank you very much.
Kia ora, Sarah. Fantastic advice and reassurance, I think, for people. It has been quite hard, I think, for people to understand the difference in the variant that we're dealing with now, Omicron, and that those simple procedures that you've talked about hopefully help people reduce the anxiety that they've perhaps had. Yes, it is a variant that for most people will be much like a cold, but clearly if you're unwell already or suffer from multiple conditions. It has all sorts of implications for your well-being and your everyday functioning, that it's far better, rather than feeling scared, to be as prepared as possible, I think, in all of the ways that our panel have outlined. And hopefully what you've heard so far has done something to help reassure you about all of these different elements. Appreciate it's a lot of information to take in. Julie, I'm just wondering whether there are particular questions that we want to ask of the panel at this particular moment. I know there have been some around access to resources and support for people who are already on benefits. Perhaps, Michael, I could invite you at this point just to say if people have questions around their specific personal situation around benefits, etc. Is there any generic advice you could give to them about how to find out what might be available to them? Thank you, Michael.
Kia ora koutou, ko Michael Coulson tukuingoa. Hi there, everyone. Great opportunity for me to talk to you about MSD's welfare support response for those people that are self-isolating. So from the beginning of February, MSD was asked to provide the social welfare support for whānau who are self-isolating. And as it's kind of been mentioned, it's thought that most New Zealanders who are self-isolating may not need welfare support, but we're definitely here for that. Most self-isolators that require welfare support are sent to us via a health system where that pushes a request for service to MSD, and we will outbound call via a telephone, obviously, to whānau to see how we can help them. Our service is open 7 days a week, Monday to Sunday from 8 AM to 8 PM. And we would make that phone call to determine from a non-clinical perspective what welfare support whānau might need. Just a point of note is the most common need so far since we've begun this back in November, that the most common need for whānau was food. And we would be very creative using some current systems that we have to get food to people, including a community connected service. We, as I said, we're very, our swim lane, as it were, is around social welfare support. But if we ever had any dealings with whānau and we were concerned about their medical health, we would get back in contact with health and let them use their expertise to take care of that. So we would definitely just be dealing with the social welfare support. There is an 0800 number that can be used. So the phone number that any whānau that are self-isolating can use is 0800 512 337. So people can use that number if they want to get in contact with us to see how we might be able to support them through any welfare needs. So thank you for the time. That's kind of that's a very overview, and there are lots of nuts and bolts in there, but that we need to work through. But that's a really kind of clear way that whānau could enter that service to us. Thank you.
Kia ora, Michael, and it's fantastic to have MSD as part of the Hauora Hub. That I think that shows our organisations are working together to try and make sure that we are coordinating all of those needs, health needs, social needs and welfare. There are some questions in the Q&A chat, and just kind of working our way through those. Some of our consumers may have some issues around communication, whether it's being able to read or write or access the information in the current formats. Can we speak to how we make information available, communication responding to flexibly to those communication needs? I'm not sure, Alison's obviously having to deal with something else at the moment. Is that something, Alison, we've just been asking about people who have specific communication needs, issues around perhaps being able to use the current formats and how we will respond flexibly to all of that. I guess we're trying to make our information available and accessible in as many ways as possible. Is there anything else you want to add to that?
I'll reinforce that. Yes, the communications work of the hub is ramping up quite strongly, and looking at information in easy read and things like that. Yeah, no, we're quite aware that not everybody gets their information the same ways, and there's a lot of over information at the moment. It's really hard to find things, and that it changes. So until it settles down a little bit, there are challenges. Yeah, don't really have too much to say beyond that, sorry.
Yeah, I think the DHB is in the process of trying to look at how we can augment our communication and engagement team to support our disabled community. So we may be able to add to this in our written response around what to do if there are issues around accessible information for anybody in our community or any whānau in particular. There may be issues for a whānau, particularly if they're concentrating on supporting people with high and complex needs. There's a question about, will there be COVID wards? Will whānau be able to be with their loved ones while they're in there? Maybe Sarah and maybe Lucinda, but we could pick that up from a perspective of someone who's being supported by the hub or someone who is admitted to hospital. Do you want to pick up the hospital one first, Sarah?
I was just going to say, let's start with the hub first. It's much more likely.
Excellent. Okay.
The hub will be caring just for a small number of people who don't maybe have a general practice, and we would really take it on a whānau by whānau basis and try to support that person however it worked for them. So we would be trying to involve the whole whānau.
Thank you, Lucinda.
Thank you. And in the hospital, basically it would be a similar approach, but there are restrictions on the number of people that the number of whānau support able to enter the hospital facilities at the moment. But we would certainly arrange for those visitor exemption passes to be issued by the identified kaitiaki.
Yes, and I think where in the past we've had admissions from individuals and consumers who are high and complex needs, whānau have been a key partner in care on the campus. So I agree with Sarah that we would be trying to sort out those visitor passes and work in partnership with that whānau. Okay, there's a question here about, will there be information on NZSL about the hubs and what they can provide? Now, I'm not familiar with NZSL, but perhaps Alison, you could help me with that one, or Grant? Grant, you're on mute, but Alison and then Grant, thank you.
Okay, so that is part of the accessible information. So we want to be developing resources in New Zealand Sign Language so that that is part of the range of communication vehicles that we have. I think that we will prioritize and we'll talk to people about what it is that is the best use of those resources. And I feel confident that's again coming on stream in the next little while.
Excellent. Thank you, Simon, helping me with the acronyms. I do know what New Zealand Sign Language is, but seeing it out of context. Thank you, Grant. Sorry.
I was just going to say, I guess that was the question that I had. Michael talked about people phoning the MSD side. Is there, other ways of making contact through text, etc., so that people who can't use phones can make contact. And if so, it would be good to send those details out to people, whether it be by text or by email.
Thank you. Michael?
Yeah, thanks, Grant, for your question. Yes, there's an online form that whānau can complete to request welfare assistance. And also, kind of like what Dr. Lucinda was talking about, we're very much open to a whole whānau perspective where people can act informally on others' behalf and make a request as well. We're quite creative about how we might deliver a welfare response. So, of course, we would welcome whānau, caregivers, support, kaitiaki, whoever might be supporting an individual or a whānau to make reps on their behalf. We would just ask a simple privacy question just to get some clearance and indication that that was the intent. We would find a creative way to do that, but we certainly would like to keep our avenues of support well open to provide that support.
Great, thank you, Michael.
Jackie, could I just also mention, sorry, I should have mentioned this before, I beg your pardon. One of the benefits of MSD being in the hub is that while we assure that the process that we have will work for whānau requesting welfare support, the human relationships at the hub are often the best way that we can work together. So I sit next to the social work team and just walk across the floor to the nursing team. So there's lots of kind of conversations that might take place where we can collaborate and work together to provide a welfare support to whānau who are self-isolating. So that might be a relevant comment, particularly for this audience.
Thank you, Michael. The next question is about people who are on disability benefit and having the resources to access pulse oximeters, thermometers, drugs, PPE, whatever they need during that situation of managing with Omicron if somebody is positive. Lucinda, would you like to pick that one up? Because I think it probably would be the hub that would be dealing with that if somebody was tested positive and was at home.
Yeah, sure. I guess one of the things to say is the pulse oximeter and thermometer and PPE gear would not cost you anything. We would send that out. So look, there may be people who choose to have that themselves, but actually that's available funded and we would send that out without you needing to pay anything. In terms of medications, there is funding available for that through the disability allowance, and your doctor can help you get that if you're not already on that. And in terms of the disability benefit and financial support, that's probably more Michael's area actually. But I think if you need financial support, then that's where either you or your caregiver could contact MSD and work out if you're eligible to some extra financial support.
Lovely, thank you, Lucinda. We have, I think this will probably be our last question now, a question regarding the prevalence of Delta in some parts of the South Island, and how do we tell the difference between that and Omicron? Sarah, can I pass that one to you, please?
Yes. Well, the way we would tell the difference is by the swab. The test would go up to a special research laboratory in Wellington, and they would see if it's Delta or Omicron. But anecdotally, what we see is that Omicron does cause milder illness, and the most common symptoms, well, there are some people that get fever, sneezing, sore throat is quite a common one, and some headachy things. Delta might have similar symptoms at first, but what we see is that this is spreading much more in certain ethnic minority groups for a start, and is also the cases and clusters that we have seen here in New Zealand have been predominantly associated with families where there's lots of people that aren't vaccinated. And what seems to happen is that because of underlying other comorbidities, which I recognise quite a few of you listening in today may have, there is a bit more of a chance that, that the infection will go to your chest. And that comes back to making sure that you are closely monitoring your wellbeing each day with support from medical practitioners, and so that if that appears to be happening, that you're getting the right level of medical support, which may include a short hospitalisation to receive some oxygen. We have had 3 people with the Delta variant in hospital in the last 6 weeks. They've just needed a tiny bit of oxygen. They haven't needed ICU or anything like that. And it's really more just that little bit of comfort because they feel short of breath rather than actual, you know, severe lung dysfunction. And they've also received intravenous antibiotics. Thank you.
Sure, Sarah. Thank you. I think that that final question brings the panel discussion and our webinar to an end. Tēnā koe koutou. Thank you so much to our wonderful panel of experts. Hopefully that information has been useful. And I know there will be many people who would have liked to have been here today, but for whatever reason had other commitments. So we are grateful to our comms team for supporting us in recording this event, and we'll be able to circulate the link through our disability steering group and through our wider networks. Many thanks to everybody, and we hope that information has been useful to you. And if there are any further questions, you can direct those to us now, and we'll pick them up and circulate our Q&A afterwards. Kia ora.